Hello.
Hi
Hello,
there.
everyone. Today we're going to hear about an amazing project being led by the Hebrew University in which they train leaders for public health in low-income countries. I'm Bruce Rosen for Israel Healthcare Highlights, and my special guest today is Professor Ora Paltiel from the Hebrew University. Welcome, Ora.
Thank you. Thank you very much for having me.
Great. Before we hear about this program, please tell us a bit about yourself and your background.
I was born in Canada. I grew up in Canada and I did all my training there. I'm a physician, hematologist, and oncologist, but I also trained in epidemiology and biostatistics. And I've worked in Hadassah. I need to correct your introduction actually, because the program is a program of Hadassah and the Hebrew University. And so I've worked in Hadassah since 1992 when I made Aliyah. And I have several hats. One of them is a clinical hat as a hematologist, and the other is a academic hat as an epidemiologist, researcher, and teacher. And my main focus in research is cancer epidemiology and clinical epidemiology. But I've had the great privilege of working with this program for many years, and I also had the privilege of, on a few occasions, being the director of the program and also being the director of the school. So I'm very familiar with it and also very proud of it.
Terrific, terrific. So please tell us about this program.
So the International Masters of Public Health program at the Hadassah and Hebrew University, it's been going on since 1970. So it's an old program. It's been almost continuous. There was 1 year where students had to be sent home because of a war, and so the start of the program was delayed by half a year. But other than that, it's been continuous since 1970. And basically, we train health professionals. 70% of them are physicians, but the other 30% have been from all health professions or health-related professions, and maybe I'll tell you a little bit about that later. And it's a 2-year program in 1 year, so it's a very, very intensive program. Some of the students even managed to do a research thesis in that 1 year, so it's extremely intense. And they go back with a master's degree from the Hebrew University and do wonderful things. If you want, I can show you some pictures and maybe tell you a little bit about the program in pictures.
Let's do that in a minute, but first tell me a bit about the countries that people come from and how the program's funded.
Okay, that's also in the pictures, but happy to do that. So most of the students come from low-income countries, and over the years, the emphasis has been on Africa, but we've had students from, I always joke, every continent except Antarctica, which is true. We've had students from Oceania and Australia and South America, Central America, Caribbean, and Europe, Asia, and North America. But most of our students have been from Africa. There were years where funding mechanisms were different. So for instance, that this was a really interesting period in the program. After the Soviet Union fell apart, there was a great need for public health practitioners in the former Soviet Union countries. And the person who recognized that was actually George Soros. And so for about 8 years, he funded over 90 participants in the program from all FSU countries, which are Tajikistan and Kazakhstan, all the way to Poland. And so there was a great influence of the school in building what's called the new public health in Eastern Europe. So that was a phase in our development. But as I said, over the years, mostly it's been from African and Asian countries.
To what extent do the students and their health systems have to pay for the program?
So students from low-income countries don't pay at all. They get a full scholarship.
Wow.
Yeah, and that's always been the aim of the program, to be able to provide that. And that's why it's always been a small program, and it's really dependent on amazing individuals who are willing, or groups, or sometimes government agencies, including the foreign ministry for many, many years, who have been willing to fund these scholarships. For a few years, the students had to pay their own way in terms of transportation, but all of their living accommodations, their
Wow.
stipend, and their tuition was always covered by the program. And students from high-income countries pay their own way.
Okay, I think it'd be great if you showed just some pictures. And while you're doing the share screen getting ready, I'll say that I, 20 years ago, had the privilege of teaching to this program. And this was one of the most motivated and most satisfied and hardworking group of students that I have ever seen. So you guys are doing something right there. So please share the screen and show us some pictures.
Yeah, so as I said, this program's been in existence since 1970. We've had over 1,100 graduates from 100 countries in the world. And as I also said, they come from everywhere, except for Antarctica. And the balance changes from year to year, according to the funding that we have, which I'll get into in a second. Apart from the very intensive curriculum that we have, and the students take a lot of core courses and a lot of elective courses, and their curriculum is accredited by the European Schools of Public Health. So it is an accredited curriculum. But besides that, we have a lot of extracurricular activities, which we consider a really, really important part of the program. In terms of the background of the students, so this is just 1 year, the students at their graduation, and you can see the various backgrounds that they come from. And maybe I'll just tell you a story about fisheries. So this student who came from Tanzania, I remember I was on the admissions committee, and a man who had a background as an environmental engineer involved in fisheries was applying to the program, and he didn't really have a health background. But he wrote in his application, there's schistosomiasis in the water in Tanzania. And when the fishermen go to fish, they get infected with schistosomiasis. And so instead of bringing food home, they actually get sick. And their kids come and play in the water while they're fishing. And so they also get sick. And I thought, well, this is a fantastic environmental issue that has public health implications. And we ended up accepting the students with a fishery background. And he learned all the basics of public health. In the end, he did his final project on building cleaning up the water and building a concrete swimming pool where the fishermen fish, so that the children could swim in clean water while their fathers are fishing. So, and he went on to do great things in Tanzania. So these are the various backgrounds of our students. We think that Israel has an amazing healthcare system, and it's not just classroom knowledge that's important to them, but it's important for them to see how a great healthcare system works, both in the voluntary and the non-voluntary sector. So we take our students to various healthcare facilities. So here you see them at Magen David Adom and at a clinic for the Bedouin population in Segev Shalom. And this is a really important part of the curriculum. Students are asked to fill out a diary and say how what they've seen on that day can be applied to their own country. The other things that we do is we expose them. Israel is the only country that lives by the Jewish calendar. And so they live by the Jewish calendar, and they celebrate their holidays, but also our holidays with them. And this is a mock Seder that we do every year, but we also send them to homes to take part in the Seder. And they also have a lot of fun and time to travel and organize trips all over the country. So it's a really, really comprehensive year, both culturally and academically. And you ask, how do we do that? Well, we would not be able to do that without scholarship support. So for many years, who supported us were the Ministry of Foreign Affairs through Mashav, their training agency. As I told you, Soros and the Open Society Institute, the Legacy Heritage Fund was very generous, but for over 3 years. And since 2004, the Pears Foundation has given us 8 scholarships a year, which is really, really substantial,
That's
mostly
great.
from African countries. And then a smattering of other individual organizations, Friends of Hebrew University, Hadassah, even Rotary, many Teva, all kinds of organizations have pitched in to give either individual or a small number of scholarships. And without that, we wouldn't be able to have this program because we wouldn't have the student population that we have.
Okay. Our time is almost up, so let's do maybe that one last slide and then we'll have to wrap up.
Okay. Okay, the one thing that I would want to emphasize is that this is not just an academic program that's short-lived, and it actually has long-term implications for the countries that these students come from. They take up major and prominent positions in government, in NGOs, in clinical practice, and in academia. We've had ministers of health who've been graduates of our program. We keep in touch with them. We have a fantastic alumni network. They're there to mentor the younger graduates and even get them jobs. And so we really consider this an opportunity for lifelong learning and an opportunity for Israel to have a lifelong influence on these amazing public health professionals. It's really a privilege to be part of it.
This has been great. Maybe you could end the slideshow.
Mhm.
And to wrap up, maybe tell me what takeaway do you have? What does this tell us about Israel, Israeli healthcare, the Braun School of Public Health? What have we learned here?
So I think in your series, you're showing that Israel has a great healthcare system, but the healthcare system is not just about innovation. It's also about healthcare services. It's also about planning. It's also about equity. And all of these things are embodied in public health and embodied in what Israel has accomplished in its short history. So I think this program really highlights a part of Israeli healthcare that maybe people don't really know about. And fantastic strides. I mean, we're ranked, I think, the highest in the world in preventive care. Maybe not the highest in the world in curative care, but the highest in the world in preventive care. And these are lessons that can be shared with the world. Um, these things make the healthcare system efficient because, when you prevent disease, people live longer for much less money. So as I said, I think this is the best thing that Israel does. It's a privilege to be part of it. The students are amazing. They go on to do amazing things. And most of them remember us and they remember Israel fondly for the opportunities that it's provided us, even though many of them have been exposed to the security situation here, and it hasn't been easy, every year, but great opportunity for them and great showcase of the Israeli healthcare system.
Ora, this has been terrific. Thank you for joining us, and thank you for all the work you do in this program and your many other endeavors. Thank you so
Thank
much.
you. Thank you. Same to you, Bruce. Thank you.